Most people with diabetes are told one thing: avoid anything sweet. That advice sounds simple until you realize it often means cutting out comfort, tradition, even joy from your daily routine. But what if nature made an exception? I'm Dr. James, and recent studies are highlighting 2 naturally sweet herbal teas that may help lower blood sugar spikes, improve digestion, and even support better sleep, all without caffeine, sugar, or pills. One of these teas contains compounds shown to slow glucose absorption after meals, while the other may help reduce bloating, regulate bowel movements, and balance hormones, especially for seniors over 60. In this video, we'll break down the science behind these teas, how to use them properly, and why they're becoming a trusted part of daily wellness for older adults. If you're ready for simple, evidence-based tips to support healthy aging, hit that subscribe button now. Let's get started. Let's begin with peppermint tea, a familiar herbal drink that holds more power than most people realize. For those over 60, especially individuals managing type 2 diabetes or digestive discomfort, this simple tea can become a valuable part of daily health routines. What makes peppermint tea effective lies in its natural compounds, particularly menthol, and a group of antioxidants called flavonoids. Menthol is responsible for the cooling sensation you feel when sipping the tea. But beyond that, it has measurable effects on the body's smooth muscles. Specifically, it helps relax the lining of the digestive tract and small blood vessels. This relaxation effect can reduce cramping, support bowel movement, and increase circulation to the gut, which is especially important as digestion tends to slow down with age. One of the most relevant findings for diabetic patients is peppermint tea's impact on gastric emptying. By slowing how quickly food moves from the stomach to the small intestine, it can delay glucose absorption. That means peppermint tea doesn't lower blood sugar directly, but it helps flatten the sharp rise in blood sugar that often follows a meal. In practical terms, your body gets more time to process sugars, reducing sudden insulin spikes. This slower response can be a game changer for seniors aiming to stabilize energy levels and avoid the crash that happens after eating. From a digestive perspective, peppermint tea also acts as a natural carminative, a term used to describe substances that reduce gas formation in the intestines. Older adults often experience more bloating, indigestion, or irregularity due to slower metabolism and medication side effects. Drinking peppermint tea after meals can help alleviate these symptoms without relying on over-the-counter medications. A study from Iran in 2019 published in Phytotherapy Research followed a group of older adults who consumed peppermint tea twice a day. After 4 weeks, participants reported significant reductions in bloating, abdominal discomfort, and nausea. Though it was a small study, the results are promising, especially considering the tea's affordability and lack of side effects. Another lesser-known benefit of peppermint is its influence on the nervous system. Menthol lightly stimulates the parasympathetic system, the part of the body responsible for rest and digestion. This means peppermint tea may help reduce feelings of tension, support calmness, and ease the body into a more relaxed state. For older adults who struggle with mild anxiety, restlessness, or occasional sleeplessness, peppermint tea offers a gentle alternative to medication. And since it contains no caffeine, it's safe to drink in the evening without worrying about disrupted sleep. When it comes to sugar cravings, peppermint tea may provide a psychological and sensory advantage. Many seniors trying to limit sugar find themselves reaching for sweets after dinner, not out of hunger, but habit. Peppermint's natural cooling and subtly sweet flavor can help satisfy that craving without adding calories or impacting blood glucose. It tricks the brain into feeling like it has had a treat, all while supporting metabolic health. Using peppermint tea properly is key to gaining these benefits. The recommended method is steeping 1 bag of peppermint tea or 1 teaspoon of dried peppermint leaves in about 250 milliliters of hot water for 10 minutes. This allows enough time for the menthol and beneficial compounds to fully infuse the liquid. It's best to drink it warm shortly after a meal to maximize its digestive effects and help control the rate of sugar absorption from the food you've eaten. If you prefer a cold drink, you can brew a larger batch in the morning, let it cool naturally, and refrigerate it. Adding a slice of lemon can enhance the flavor without compromising its health properties. Just be sure not to add sweeteners if you're trying to manage your glucose levels. Overall, peppermint tea may not sound like a revolutionary solution, but for many older adults, it offers comfort, relief, and subtle but meaningful improvements in daily health. By helping the body process meals more gradually, reducing digestive discomfort, and promoting a relaxed state of mind, peppermint tea is far more than a soothing beverage. It's a small daily habit with big potential benefits. Now that we've covered peppermint, let's turn to a second naturally sweet tea that's gaining scientific interest, fennel tea. Like peppermint, it offers both digestive support and blood sugar benefits, but through a completely different biological pathway. Let's take a closer look. Now, let's move on to fennel tea, a slightly sweet, licorice-like herbal drink that has long been used in traditional medicine for digestive health. In recent years, fennel has drawn attention for its potential role in blood sugar regulation and hormonal balance, especially in older adults. Fennel seeds contain a variety of active compounds, including anethole, fenchone, and estragol. Among them, anethole stands out for its biological activity. Structurally similar to some plant-based estrogens or phytoestrogens, anethole may help influence hormonal signaling and metabolic processes in the body. For seniors, particularly postmenopausal women, this can offer gentle support to the endocrine system, often overlooked in standard care. But fennel's benefits go beyond hormones. Of particular interest is its ability to inhibit an enzyme in the small intestine called alpha-glucosidase. This enzyme is responsible for breaking down complex carbohydrates into glucose. When alpha-glucosidase is inhibited, carbohydrates are digested more slowly, leading to a gradual release of glucose into the bloodstream. This mechanism is remarkably similar to that of some oral diabetes medications, such as acarbose. While fennel is not as potent as prescription drugs, its mild inhibition of this enzyme may contribute to a more stable post-meal blood sugar curve, especially when combined with a low glycemic diet. Studies on fennel's impact on glucose have shown promising signs, though much of the current evidence comes from animal models. In one such study, diabetic rats given fennel extract showed significant reductions in both fasting blood glucose and hemoglobin A1C levels after 6 weeks. Human trials are still limited, but the physiological plausibility is strong. That means, while fennel tea shouldn't replace medical treatment, it may serve as a helpful dietary complement for seniors managing insulin resistance. Beyond its metabolic effects, fennel also offers considerable support for the digestive system. Many older adults deal with irregular bowel movements, abdominal discomfort, or drug-related gastrointestinal side effects, particularly those on metformin or blood pressure medications. Fennel tea helps by reducing smooth muscle spasms in the colon, stimulating bile flow, and easing gas buildup. Its soothing effects can be felt within an hour, making it a practical post-meal beverage. The tea's phytoestrogenic properties also provide secondary benefits, especially for women over 60. Hormonal changes after menopause can bring about hot flashes, mood swings, and sleep disturbances. Some clinical studies have found that fennel extract may reduce both the frequency and intensity of hot flashes, likely due to its gentle estrogen-like effects on the central nervous system. This makes fennel tea a multifunctional drink, one that addresses both metabolic and hormonal shifts common in older adulthood. Another useful trait of fennel is its mild diuretic action. By promoting fluid excretion through the kidneys, it may help reduce swelling in the hands, feet, and ankles, a common issue in seniors with heart or kidney concerns. This action is gentle and doesn't deplete electrolytes, making it safer than most over-the-counter diuretics for occasional use. Fennel also has antimicrobial properties that benefit oral health. Drinking fennel tea after meals can help freshen breath, particularly after eating garlic, onions, or protein-heavy dishes. Some even use cooled fennel tea as a natural mouth rinse for sensitive gums or dry mouth, both of which are common in older adults. For optimal use, fennel tea can be prepared using either dried fennel seeds or commercial tea bags. The traditional method involves boiling 1 teaspoon of crushed fennel seeds in a cup of water for about 10 minutes, then straining and sipping slowly. It's best consumed after dinner when digestive activity and relaxation are both desired. If you prefer a cooling version, you can refrigerate the tea and drink it cold, perhaps with a slice of cucumber or a bit of mint for added flavor. As with peppermint, fennel tea should be used consistently but moderately. 1 to 2 cups per day are generally well tolerated and sufficient to provide digestive and metabolic support. While fennel is considered safe for most people, those with hormone-sensitive conditions or who are taking blood thinners should consult their healthcare provider before incorporating it regularly. Fennel tea is not a miracle cure, but it is a deeply nourishing, versatile herbal option that supports multiple systems in the aging body. From glucose metabolism and gut health to hormonal balance and mild diuresis, its benefits reflect the complexity of the human body and how nature, when used wisely, can still offer practical tools for better aging. Now that we've explored both peppermint and fennel tea, let's take a moment to talk about how to use them safely and effectively. Because like any health habit, the benefits only come when used the right way. While peppermint and fennel tea offer promising health support, it's important to understand that their benefits depend heavily on how they're used. Even natural remedies can be ineffective or even counterproductive if applied in the wrong way. The first thing to consider is your current health condition and any medications you may be taking. For example, if you are on blood thinners such as warfarin, fennel may not be the right choice for regular use without guidance. This is because fennel contains small amounts of natural compounds that could affect clotting factors when consumed in large or consistent quantities. Similarly, peppermint can cause mild relaxation of the lower esophageal sphincter, which may increase acid reflux in sensitive individuals. If you have been diagnosed with GERD or severe acid sensitivity, drinking peppermint tea on an empty stomach or before bed may not be ideal. It's also important to recognize that while these teas offer blood sugar support, they are not replacements for medical treatment. They should never be used to delay or avoid prescribed medication. Their strength lies in complementing a healthy lifestyle, not replacing essential interventions. If you're using insulin, oral diabetes medications, or have advanced complications, always speak with your healthcare provider before adding herbal therapies to your routine. Next is dosage and timing. Many people assume that if 1 cup is good, more must be better. But with herbal infusions, more isn't always more effective, and excessive intake can lead to mild digestive upset or nutrient malabsorption. In general, 1 to 2 cups per day is considered a safe and effective range for most seniors. Drinking peppermint tea after lunch or dinner can enhance digestion and help manage post-meal sugar curves, while fennel tea is best reserved for after-dinner relaxation and overnight glucose stability. Avoid drinking either tea on an empty stomach, especially in the morning. Herbal teas with active volatile oils like peppermint and fennel can irritate the stomach lining if no food is present. It's best to have them after meals, when the digestive system is already active and ready to benefit from their soothing effects. Storage also plays a role in maintaining potency. Both peppermint leaves and fennel seeds should be kept in airtight containers, away from heat and direct sunlight. If you're using tea bags, make sure they are sealed and not expired, as the natural oils that provide therapeutic effects can degrade over time. Some seniors may also wonder whether it's okay to combine these teas with others. In most cases, blending peppermint or fennel with caffeine-free teas such as rooibos or chamomile is perfectly safe. In fact, combining fennel and chamomile in the evening creates a soothing blend that supports digestion and calm sleep. However, avoid mixing with stimulant teas like black or green tea if your goal is relaxation or glucose control. Lastly, always observe how your body responds. Every individual is different. Some people feel immediate digestive relief. Others notice subtle changes over a few weeks. Look for signs like improved meal tolerance, reduced sugar cravings, better sleep, or less bloating. If you experience any adverse effects, such as increased reflux, nausea, or headaches, pause and reassess with your doctor. The bottom line is this: even the most natural options require thoughtful use. Peppermint and fennel tea are safe for the vast majority of older adults, but like any health tool, they work best when integrated properly, with intention, moderation, and a clear understanding of your own needs. In the next and final section, we'll summarize what we've learned and offer a simple action plan you can start today. Because small, consistent habits, like a cup of tea, often lead to the biggest changes over time. Peppermint and fennel tea may seem ordinary, but they offer more than just comfort in a cup. Through gentle digestive support, nervous system relaxation, and blood sugar stabilization, they serve as practical tools for aging bodies seeking balance. You don't need exotic supplements or expensive formulas to care for your health. Sometimes, the most effective changes begin with simple, time-tested habits. A warm cup after a meal, a moment of stillness, a subtle shift in how your body responds. If you've been looking for a gentle way to improve how you feel after eating or sleep more soundly at night, this could be your next step. So tell me, which tea will you try first this week? Peppermint or fennel? Share your answer in the comments below. And if this video helped you, pass it along to someone who could benefit too. Until next time, stay informed, stay proactive, and stay well.